Welcome back to the front page. It's Wednesday, which means your eye on health with Dr. Sudip Bose from Medical Center Hospital. Doc, thanks so much for joining us today.
Huh? What? I can't hear you. I was at a loud concert last night. I can't hear anything.
Well, that's just the topic we're talking about today, then, is hearing loss today. And the doc obviously suffers from this.
Yes.
What are we talking about?
We're talking about traumatic hearing loss. Okay. And when we talk about this, you may think we're talking about our ears. Mm-hmm. But actually, we're talking about life. Sure. I mean, this starts as, if you look at like elderly patients as they lose their hearing, which is natural. First, you may miss a one-liner on your favorite television show. Right. And then after that, you start missing conversations. And then after that, people start socially withdrawing because they're not able to converse and they're not hearing everything. That's terrible. And with traumatic hearing loss, if you talk to rock stars, for example, you know, the thumping bass may seem cool now, but when they lose their hearing at age 30, it's not that cool. Right. And this is preventable. So they feel like, these rock stars feel like they're 80, 90 years old, they say, and that's their biggest complaint sometimes. And they even wear hearing protection. So let's talk about this. We brought hearing protection. It's not as simple as earplugs. Ideally, what you should do is you have the internal earplugs. Okay. So go ahead, put these in.
We have these. I like to use these when I sleep sometimes, if there's loud noises.
There you go.
Okay.
And now you don't have to listen to my voice.
A little better. Well, I can still hear you a little bit.
Okay. Right. So that's why you have this. This is the external one on top of that.
Got it.
Yes. That is good hearing protection. And for those of you working in this area with loud machinery, construction machinery, you know, consider hearing protection. Right. Down the road, you know, it can cause lifestyle problems. Like I said, it's not just the ears.
And you may not even realize that you're around loud noises. You don't. You could be in a workplace where it's loud machinery, and that could be all that it is, even if you have an office tucked away. So it's good to protect yourself.
And it's not just machinery. I mean, those of you using motorcycles, listening a little too loud with your Walkman or with your music when you're...
or the TV, the front page, turn it down, it's too loud.
Yes, and then you know, for those of us listening on our Facebook pages, it's broadcast nationally. If you're in areas with snow and you have snowmobiles, you know, those are loud too. So just use a common sense of what's loud. And let's try to prevent this in the first place. This starts as ringing in your ears. If you're having ringing, that means you're probably exposed to noise that's a bit too loud, but then it can become permanent.
Absolutely. I know we're talking a lot about preventative care. Then what happens if you were a groupie back in the 70s, the 80s, and you are suffering from this? What can you do? I know we talk about hearing aids. What are your options at that point if it's too late?
Right. You want to do this so you're not at that point reading lips and, you know, trying to figure out what people are saying, but then you're looking for hearing aids. You don't want to get to that point, and cochlear implants and things like that. But this is no substitution to our natural hearing. Absolutely. So let's prevent this in the first place.
Or if you are experiencing some hearing loss, you can there's still time to prevent it from getting worse.
Right. Yeah. So you can get it checked, you can go to your doctor, get a formal hearing test, because sometimes you lose your hearing in one pitch or another, and catch it early and get that addressed.
Right, and I'm sure some of the moms at home might want this for home when the kids are running around screaming. It tunes it out really nicely. All right,
good advice. Always good advice here.
And if you have any questions you'd like answered here on the front page on Wednesdays, go and submit them there to the email at the bottom of your screen. Thanks so much. We'll be right back.